Thanks for joining us again for BRMC's Healthy Connections. We have Dr. Matt Wilson, a homegrown mountain home young man here today. See, I can say young man. And Mr. Mike Beam with Human Motion Institute. And we've covered quite a bit of the back and the procedure that's done, and wanted to get into the arterial system today and get into the veins and have you talk a little bit more about that, if you would please, Doctor.
Okay. Well, probably the first place to start would be to talk a little bit about arteries and veins. They're both part of the circulatory system, but a lot of people get that a little bit mixed up as to what's what. So the arteries are the vessels that provide flow down to the feet in the legs, and that's under high pressure coming straight from the heart, and the veins are the vessels that bring the blood back up from the legs to the heart. And so the disease in those two systems is different. In the arteries, normally what we're looking at is basically hardening of the arteries, which is atherosclerosis, and that causes blockages. And just like in somebody who has diseased arteries of the heart, the legs can have problems where they don't get enough blood flow. And the blood brings oxygen and nutrients to the muscles down there, and what happens is if you have a blockage in the artery, if you're just sitting there doing nothing, usually it's not a problem. But when you start walking and the muscles need more oxygen, they don't get enough of it, and then people will feel a cramping sensation in their legs, usually down in the calves first. And that would be the first sign of a problem with the arteries. And as that gets worse, then they might develop pain that won't go away, or maybe ulcerations or something like that. So this is a diagram over here, if you can pan over, and this shows basically the arteries in the body, and it starts from the heart, and the blood goes down the aorta and splits and goes down both legs down into the feet, and that's the arteries, and then the veins would basically parallel that, providing flow back up towards the heart. So for people that have what we call claudication, that's pain in the calves when they walk a certain distance, there are procedures now, like we mentioned before, that we can do with a catheter to open those vessels up, which is a lot of times is going to prevent them from having to have a major bypass surgery. And what we can do is put a catheter into our artery, and usually we inject some x-ray dye to see what's going on. And if there's a blockage, we can take a lot of different tools that we have to open that artery up. The basic thing is to take a catheter with a balloon on it and blow it up in the artery, and that just basically widens it up just like you'd think. And a lot of times that's all that's needed. We have some other fancy tools, like we have a catheter that has a laser on the end of it. If there's a lot of blockage through there, we turn the laser on, it can just kind of zap that blockage and it gets it to dissolve basically. We have other catheters that have kind of a little spinning part to them that can kind of ream it out. Yeah, and it's all little micro catheters and things like that. And then if it doesn't want to stay open very well, we can put a stent in it
and keep it open.
Right. And then so that's the arteries. Veins, it can be two problems that we deal with when it comes to veins. It might be that there's a blockage that's a narrow vein, and we can go in there and use the same tools with a balloon and maybe put a stent in there. But the other thing is sometimes we want to close a vein down instead of open it back up. And that also is an alternative to surgery. People that have varicose veins can have a lot of pain and tiredness and fullness in the legs from that. There's a surgery that can be done that's called vein stripping. That is a pretty big surgery. Most people find that they don't think it's really worth it at the end of the day to have that surgery. And so for a lot of people, varicose veins has been something that's kind of been swept under the rug a little bit.
What are your recommendations for the varicose vein sufferers?
Well, if they are suffering from them and they're having pain, they should come see a doctor about it, because there are some procedures that we have nowadays that are a lot easier on the patient. And And also we have tests to really delineate what's going on in there better than we used to in the old days. Nowadays we can take an ultrasound and look at the veins in the legs and see which vein it is that's causing the problem and what's going on. And for most people with varicose veins, there's a vein that has reflux in it, which basically means instead of the blood going up towards the heart like it's supposed to, it goes up and then it comes right back down again, because there are valves in that vein that are supposed to keep the blood from going the wrong way. And if the valves aren't working right, then the blood goes backwards, and then it just backs up into what used to be little veins, and over time they get dilated up and they become varicose veins.
What are the causes for a lot of this? Is it just part of the aging process? Is this diet? Is this lack of exercise? Or?
Well, when it comes to the veins, it's a lot of different things. Some of it is age. It's more common in women. It's more common after more children. It does tend to run in families somewhat. It's more common with people who are on their feet a lot or sit a lot, like a trucker or something like that. Weight is related to it as well, somewhat.
Okay, too much weight.
Yeah. And so, the conservative treatments for that are to wear compression stockings, which just kind of squeezes the blood out of those varicose veins. But that's not something that most people are willing to do on a long-term basis.
Well, one question I had too, you talked about closing a vein down. It's my understanding, tell me if I'm right or wrong, when you close a vein down, after a certain amount of time, does number one, a vein regenerate around that? And number two, is that old closed down vein absorbed by the body?
If it works optimally, what you're going to do is you're going to close down a vein that's not working right to begin with.
Right.
So you're hoping that you're not just going to make another vein to go around that vein, another vein that's not going to work correctly. Usually most people have good veins that are deeper down in the leg. The deep veins are bigger veins, and usually they don't have reflux. So if you get rid of the bad vein, the good veins take over. And you don't necessarily have to make any new veins.
But good question.
That's a good question. Now, some people will make new veins, and sometimes they'll have other varicose veins that pop up years and years down the road after they've had a vein stripping or something like that. So your body does make new veins, particularly if you're not getting the blood out of your legs as well as you should.
Yep.
And the other question about what happens to that vein that you close down, it hopefully will scar down and pretty much be reabsorbed.
Okay.
So if we came back, if we came back with an ultrasound and looked a year later, hopefully we wouldn't be able to see anything at all there.
There may be some trace material, maybe.
Yeah.
Maybe.
I mean, there probably would, but
Okay.
you might not be able to see it on ultrasound, or you
Okay.
might, but hopefully at least it would be still closed down.
Very good.
So the procedure the advancement that we have these days is we can put a catheter into that vein that we want to close down, and the catheter has a laser on the tip of it, and what that does is it gets hot, and we just numb the vein up, and we turn the laser on, and we pull it slowly back through that vein, and it injures the inside lining of the vein, and it just closes down. So rather than take it out, we just close it down from the inside, and that's an outpatient procedure that's a lot easier to deal with for the patient.
And you can vary the intensity of the light, I'm assuming. I mean, is that
you
something
can.
you can do?
If it's a little bit closer to the skin, we might put it at an easier setting to avoid any burn to the skin.
Yeah.
Wow.
But the other thing that we do that really helps out is, again, we use imaging, an ultrasound, to help us numb the vein up. So we put a lot of numbing medicine around that vein, and it just basically surrounds the whole vein and collapses it, and also pushes the skin away, so that when you treat it with the laser, it's protected.
Yeah. That's pretty amazing.
It
It's like
is.
Star Wars
It is.
technology here. With,
I mean, I can't imagine, what physicians were looking into the future, trying to figure out what would be prevalent, 20, 25 years ago, even 15 years ago, even maybe 7 or 8 years ago. With some of these technologies, just mind-blowing.
The changes, and the changes are probably, even as we speak here, just somebody's out there thinking up another whole method.
There are a lot of things out there. One thing that's really growing in my field, and we're hoping to bring here at some point, will be cancer treatments with interventional radiology, where you can put a catheter into, let's say, the liver if it has tumors in it, and zap it with either heat or cold
Is
to
that
treat
the
those tumors.
liver ablation?
Liver ablation. And then also you can put a catheter into an artery that has the blood flow going into the liver, and put some chemotherapy directly into the liver.
Wow.
And there are even little microscopic radioactive beads that you can flush into the liver and treat tumors of the liver and the kidney.
This is just
and things
amazing.
like that. Yeah. And who knows, at some point there may be gene therapy agents that we can inject that can help people. I'm sure that will happen at some point.
Wow.
Well, we will. We just thank you guys, because it's all going to be there down the road when I need it.
That's what we keep hoping for. It's all there for all of us.
Exactly. Well, Mike, we need to give you some airtime.
Oh, that's fine.
Tell
that's
us what's
fine.
going on with Human Motion Institute.
We, as you and I, it's easy for us to know. We kind of live in the world, but Human Motion Institute is basically our orthopedic services for Baxter Regional Medical Center, and we help about 8 physicians. Dr. Wilson's one of them, and beginning to work with others as well. Some exciting things we have coming up. I think we have a 5K coming up in December, the week before Christmas. I think it's going to be called the Jingle Bell Run, and the team is insisting that everybody wear jingles on their shoes. But whatever,
Well,
we're going to have a lot of fun. But yeah, we're having a lot of fun with these physicians, and trying to do the best things for the patients we can.
Sure. Sounds wonderful. Well, I want to thank you both so much for stopping by today to BRMC's Healthy Connections. You've certainly give our viewing audience a lot of valuable information to digest and think about, and definitely to help them about the procedures that you perform. Dr. Wilson, how could someone reach you?
They can call my office, which is 425-3737.
425-3737.
That's right.
Okay. And Mike, how can we reach you?
Reach me at 508-1009 or through baxterregional.org.
baxterregional.org, 508-1009. Thank you both very much for joining us today. We're just loving what we've got going on here with our Healthy Connections. We'll see y'all next week. Stay tuned for next week's show. We'll see you then. Bye.